Well, it is a very strange story, Rob, because we've heard about this for 30 years. Politicians, both Republicans and Democrats, have been talking about how strange this is, that we should be paying these enormous prices in our country for drugs. And, 75% of the pharmaceutical revenues in the world come from the United States, and we only have 4.2% of the world's population. And that's because of this tacit agreement that we would finance all the R&D for these companies, and then they'd be able to sell them in other countries at rock bottom prices, and that people in our country would pay the bills. And today, this is about half the Medicare cost, Medicaid costs, and it's bankrupting Americans. The number one cause of bankruptcy in this country today is healthcare.
Yeah.
So, when people's lives are completely shattered and broken by it, and it's that pain that is financing the cheap drugs in Europe. So President Trump, and by the way, Bernie Sanders for years has said this is what he wants to do. He's been trying to get the Democratic Party to do it. The Democrats haven't been able to do it. The Republicans haven't been able to do it because the power of the pharmaceutical industry. There are more lobbyists from pharma on Capitol Hill than there are senators and congressmen combined.
You said like 3 to 1 today, didn't you?
It puts 3 times as much into lobbying as the next largest lobbying industry. It's not really the pharmaceutical industry fault. It's the European nations who are price fixing.
Yeah.
And taking advantage of us, and so we are now going to fix that.
Yeah, I mean, Trump said today that the Europeans essentially threatened to block medications from entering their markets unless they can get it at the price that they want, which is insane. I mean, I don't understand how they pull that off, because without those medications, their people are sick. But he says that's what's happening. Is that accurate?
Yeah, well, the Europeans have a different approach to healthcare than we do. It's socialized medicine.
Yeah.
Part of the cost, and there's advantages to that, but there's a lot of disadvantages. One of the disadvantages is there's a lot of drugs that are just unavailable in Europe. And you have a lot of medical tourism to the United States because people can get drugs here that just aren't available in Europe. You're going to pay a lot more, but the drugs are here. And in Europe, they restrict them so they can say to the drug company, we're not going to allow you to sell that drug in our country unless you give us basically the cost of manufacturing it.
Yeah.
And those are the bargains that they drive, and it's a form of price fixing. And crazy. We are subsidizing socialized medicine in Europe on the backs of the American citizens who are going bankrupt to pay these costs.
I think one of the ways that they get away with it is that I don't think Americans, because it gets so confusing between Medicare and insurance, how much things cost. People don't really understand it. Marty McCary had a great moment today where he explained it in a way that I thought really connected. Let's go ahead and play that soundbite.
Imagine buying a Ford for $175,000, a regular car, and then hearing that people in London are buying it for $10,000 every day, all day long. That is the craziness of this system.
I thought that connected well. I guess the question is this going to stick? I mean, Trump said if the EU tries to get cute, he said, and subvert this in some way, that he's gonna drop the hammer on him. Are you guys going to be able to, this executive order, you think this will stick and we'll see the results of this?
Well, I think it will stick, Rob, and the reason I think it'll stick is because I think the pharmaceutical companies know that it's time, and we've been meeting with them, and, this was not a surprise to them. I had meetings with most of the CEOs last week, and I gave them at least a veiled warning that this was coming, but they knew it was coming. Yeah. And one of the things that they really want is to get rid of the middlemen, to get rid of the pharmaceutical benefit managers, the PBMs, who collect a lot of the money and don't produce anything. They're supposed to bargain, for better prices, but there's all kinds of ways that they can make money on it. And it's been a thorn in the side or a stone in the shoe of the pharmaceutical companies for years.
Yeah.
And one of the things that we did with this executive order is to eliminate the PBMs in these transactions. So I think that's something that's a carrot for the pharmaceutical companies. And then, you know, there's a stick too, which is we have ways of enforcing this if we can't come to an agreement.
You know, everybody's reporting the same stories, the same spin. You turn the channel, it's always the same. But not us. We're different. We report the real news. No spin, just the facts. Turn to us, and you won't turn back.
Tune in to Rob Schmitt tonight on Newsmax.